All of us have mental health just like we all have physical health, and it is critical that we all take care of our mental health in the same way we would take care of our physical health. Just because somebody has a diagnosis of diabetes doesn't mean that they're bedridden at home or in a hospital. Individuals with diagnosis of mental illness can also experience that well-being by virtue of taking care of themselves, having supports, and having clinicians who take care of them. Mental health challenges can exhibit themselves both in physical, mental, behavioral, cognitive ways. So that could manifest itself in terms of stress, anxiety, worry, sleeplessness, aches and pains. The four main stages of mental health are mentally healthy, the green, then the yellow would be sort of the reactive stage, and then there's the injured state, and ill state, the red. And so we can easily move to a reactive stage by virtue of being stuck in a traffic, by virtue of worrying about our children, by virtue of going through a separation of some sort, or worrying about our own health or somebody else's health. Any life circumstances can move us down the continuum towards illness. So just like with physical health, we can get a cold, or we can sprain an ankle or have surgeries. With physical health, we can sustain injuries and be exposed to various circumstances that may impact our mental health and cause us to be in an injured or ill state. Oftentimes we think of mental health as something very private and that does not belong in the workplace. We spend over 60% of our waking time in a workplace, and it is naive to think that the environments that we work within don't impact our well-being and health. Stigma around mental health is dangerous because it isolates us and it prevents us from seeking help and talking about mental health challenges. It is values and beliefs around who is exposed to mental illness. I hear people talk about mental illness as being something that's out there, that's experienced by people who have, let's say, their will is not strong enough, or they're somehow disadvantaged, where really in reality we all are susceptible to mental illness by virtue of being human. So stigma really isolates us and reduces people's ability to talk about mental health challenges, to seek help, which really just perpetuates the problems and the issues, and often results in consequences that are life-threatening. Even the idea of using mental health and mental illness interchangeably is a misnomer because they're very distinct and different. And so there's still a lot of work to be done around awareness and acceptance and reducing the judgment behind mental illness and mental injuries. The best way to approach someone who you think is maybe struggling mentally or having some kind of challenges is to come with curiosity and non-judgment, asking them how they are, acknowledging that they may not be themselves today, and being open to hearing what they have to say. Suggest a resource where they can go and talk to someone about their sort of more intimate details of the situation. If we don't have a healthy workforce, who's there to do the work, right? So employees are really the resource to organizations to be able to do the business and do it well. It is critical that we do it well. The world is way too competitive not to do the work that we do well. And it's too dangerous, not only for ourselves, but also for the clients that we serve. So having a psychologically healthy workforce is in everybody's best interest. Organizations that are very proactive and very dedicated to the well-being of their employees are engaging in incorporating psychological health and safety in their workplace. They're proactive. They know that if they take care of their employees, their businesses will be successful and productive and creative and innovative. It's not a matter of creating policies and putting them on the bookshelf. It's very important to implement them, evaluate them on a regular basis, their use and effectiveness, and utilizing them in a very active and proactive way. We would love to see both the employees and the leadership of organizations to come together and create environments that are healthy and safe for everybody.